Good afternoon. Welcome to Special Report, the afternoon edition. We're just waiting right now for Premier Doug Ford's press conference to start. Today he'll be joined by the Deputy Premier, as per usual, Christine Elliott, who's the Minister of Health. Today there'll be Monty McNaughton, who's the Minister of Labour, Training and Skills Development, Dr. David Williams, he's our Chief Medical Officer, and also Dr. Dirk Heyer, who's the Chief Coroner for Ontario. But as we're waiting for Doug Ford to come out, we're going to take a quick look at the weather. Things are actually looking better in terms of at least it's not raining anymore. So we're looking at right now, we're around 14 degrees, so not exactly summer temperatures. However, at least it's not raining, it's just cloudy right now. We could get up to 16, so it might go up a couple degrees later in the afternoon. Our low is 11. But tomorrow is when things are starting to look up a bit. We're going to be at 22 as a high tomorrow, low of 14. So basically the temperature right now is the low for tomorrow. And then Friday, it'll be sunny, partly cloudy. We're looking at a high of 26 degrees, starting to get into the summery weather again with the low of 18. However, today we're done with the rain for the time being, but you could see some windy gusts this afternoon around 30 kilometers an hour. Nothing too serious, but enough that there's actually, you'll feel the wind. Okay, so the Superior Hospital has a surplus. Yes, our hospital has a surplus of $700,000. Their annual general meeting was just the other night on Monday night. Obviously, it was done differently than normal. They didn't give out any of the awards that they normally give out at the annual general meeting. They also had to do it, it was all done digitally. So the meeting was not open to the public at all. Normally the meeting can go and you can ask questions, things like that. Plus the agenda was incredibly brief, so I'm just going to go over some of the highlights. As I mentioned, there's a surplus of $700,000 from hospital operations. Also, for physician recruitment, they now have credentialed over 300 physicians. And as far as they have a new thing called the Patient and Family Advisory Program. The number of advisors has now grown up to 80 members. They also have 530 volunteers, and they're also very happy they added 173 staff over the last year, 69 nurses, 32 allied health professionals, and then also 72 support team members and leaders. And Doug Ford is coming out, so we're going to cut to him, and I'll be right back after Doug Ford. Here we go.
Well, good afternoon. For the past few weeks, we've stood here and made a commitment to do everything in our power to reopen every region of Ontario safely and gradually. And throughout the course of this pandemic, we faced challenges and roadblocks. But each time, we worked with our partners, the healthcare workers, volunteers, and medical experts to take quick and decisive action. We addressed the issue head on. And for every challenge, we gathered our resources and we got back on track. Because as I said from the beginning, the only way we'll beat this virus is if we stick together. Today, Cabinet will convene with the intention of allowing parts of Windsor-Essex to open. With the exception of Leamington and Kingsville, Windsor-Essex will move to Stage 2 tomorrow, effective 12:01 a.m. on June the 25th. And right now, we need to work together to support the rest of Windsor-Essex so that all of Ontario can get back on track. The outbreaks at our farms is a new challenge, and it requires a targeted response. Today, we're launching a 3-point plan to help the rest of Windsor-Essex move into Stage 2. As a first step, we have expanded testing on all farms, starting with the largest ones. Matt Anderson and Dr. Heyer and the team at Ontario Health have been working with local hospitals to send the mobile testing units to the farms. We're bringing the testing right to their doorsteps. Anyone who needs a test can get a test. And I want to thank the farmers, I really do. Thank you to the farmers for their help. This is the only way we can contain this virus. And that leads to the next point of our plan. I want to send a clear message to the temporary workers. No one will lose their job if you have COVID-19. No one will be sent home if you have COVID-19. And if you test positive for COVID-19 and you need to self-isolate for 14 days, You will be eligible for WSIB benefits, and in some cases, if you worked here last year and you have a social insurance number, workers may be eligible for the federal CERB benefits. Our temporary workers have access to the same benefits and protections as any other worker. We stand shoulder to shoulder with our farmers and our workers. And we're here to support the essential workers who come here every year to help put food on our tables, because we're all in this together. I also understand that our farmers are often on the seasonal schedule, and this is one of their busiest times of the year. They need the extra help, and unlike other professions, most of it is outdoors and isolated. So to further support our farmers, the third pillar of our plan is a new public health guidance for asymptomatic workers. This guidance was developed in consultation with Dr. Williams and his team of experts. This new protocol will give farmers guidance on isolating workers who have tested positive for COVID-19, but who have no symptoms and who can still safely work outdoors in isolation. With the support of our farmers and workers, the rest of Windsor-Essex can get back on track so all of Ontario can reopen and get back to work. And we'll be there every step of the way to look out for our farmers, to look out for our workers, and make sure our economy comes roaring back stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Since the start of this outbreak, it has often been said that we are all in this together. The steps we are taking today to build on and support the work of the Windsor-Essex County Health Unit reflect our commitment to the health and well-being of all Ontarians in all parts of the province. We know that testing on farm sites is challenging and that there are many variables that make it difficult. By providing both farmers and employees with economic certainty, this three-point plan will allow the rapid scaling up of testing in agri-food sector workplaces across the region. As we do, we can identify and isolate cases of COVID-19 and help put a stop to further spread of the virus. Taking these targeted actions and building on our collaborative and comprehensive response already in progress will help this region to be ready to move completely into stage 2 and safely reopen. And I do want to strongly recommend that everyone in Ontario please continue to follow public health advice, including maintaining physical distancing, wearing a face covering if physical distancing is a challenge, and practicing hand hygiene. These are the most important things we can do to protect one another so that we can all come through this together. Thank you. And now I'll pass it over to Minister McNaughton.
Thank you, Minister Elliott, and good afternoon. As the Premier announced, Ministry of Labour, Training and Skills Development inspectors are beginning a new round of inspections today. They are teaming up with federal inspectors and local public health officials to conduct the first joint inspections on farms in the Windsor-Essex region. Inspectors will look at workplaces and living quarters, which is key, because provincial inspectors don't have jurisdiction over the bunkhouses. These new inspections are just one more way our government is ensuring its workers are healthy and safe, regardless of their nationality. Because in Ontario, migrant workers are entitled to the same benefits and protections as any other worker in this province. That includes safety and insurance benefits, which are administered by the WSIB. It also includes protections afforded by the Employment Standards Act. A worker's passport does not determine how they are treated in our system. That's not the Ontario way. The law in this province is clear. Employers must take every reasonable precaution to stop the spread of infectious diseases like COVID-19, and there are stiff penalties for anyone who doesn't follow the law. As we know, the vast majority of employers in this province are doing a great job. To all of you, keep up the good work. The adjustments you've made haven't been easy, but they are critical to get Ontario back to work safely. If you are an employer and need more help adjusting to the new conditions, please check out the nearly 200 resources we have posted at ontario.ca/COVID safety. These resources have been translated into multiple languages, including French, English, and Spanish. And if you are an employer that is not taking this situation seriously, there will be consequences. To successfully reopen Ontario, we need everyone to do their part to protect the health and safety of workers. The connection between workplace safety and our economic success as a province is crystal clear. That's why we all must do our part together. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Brian Cross from Windsor Star. Please go ahead.
Hi, Brian.
Hi. Could you please explain that third directive? Did I get it right that people who are asymptomatic but are COVID-19 positive, that's how you deal with those guidelines for dealing with them?
Yes, that's correct, but I'll pass this to Dr. Williams.
So when we originally started doing asymptomatic testing, we put out guidelines that if you find an asymptomatic worker who is positive but has no history of contact or other risk factors, we found ways that the person could separate themselves from the other members of the workforce, work on the job if that was permissible by the employer, and continue to do so until we monitor symptoms, and if they develop any, that's one thing, and to get retested. Because sometimes we find some people who we're already resolving, if you retest them again, they become negative. And so we saw that as a false positive in a sense, positive lab test, but a negative one as far as clinical impact. We found out on this event here, it was the first, we had a cluster of asymptomatic workers who tested positive. So we put out a cluster method where you could take those individuals who are asymptomatic and are still test positive and ask them to work separately from the rest because they're mostly on farms, they're out in large acreage. They can daytime have no problem. They would wear facial covering, of course, and then how the farmer would work to have them sleeping in separate together, away from the rest of the workforce and from eating and etc. So they're not interacting with the rest of the workers. We would monitor them. We would retest them within 48 hours. And if any developed signs or symptoms, we would have to deal with them as possible cases. If they turn negative, they could resume their duties and go back and work with the workforce, the same as the rest. So it was an adjustment to our previous policy because we hadn't seen this cluster type picture of a group of asymptomatic workers in one location that were test positive but asymptomatic.
Follow up?
Yeah, is this unusual? Like, has this been done anywhere else where non-migrant workers, a cluster of them test positive and they work in any case?
Ontario is one of the first provinces to do a lot of asymptomatic testing. That's what Dr. Heyer has been undertaking in various settings, including on farms, some in workplaces. So as a result, we haven't got a lot of information and science behind this in Canada. So we're one of the leading ones in doing that. So in a way, we're breaking new ground on that, understanding what the tests mean, because you may have a positive test, you may have already resolved from a previous infection, and if you have any just remnants of even dead virus or parts and bits and pieces, our test is so sensitive, it'll pick that up. But of course, if you wait for a day or two until it clears, they would turn negative again. So we're learning more about our testing, how that fits in the overall clinical picture, and when cases are resolving, some people can keep some in their nasal passage for a period of time, even though they're no longer infectious or are infected at that moment. So as we learn more, we change things, we adapt, and we discuss this with our federal, provincial, territorial partners.
Next question.
Next question comes from Krista Lee Farley from AM 800. Please go ahead.
Hi, Krista Lee.
Hi, Premier. I understand you're coming down here for a haircut now.
Yeah, I am. You know, once we get Leamington and Kingsville, Krista Lee, and we're going to work together. And it's amazing when you work together and everyone's kind of pulling in the same direction, how we can get this resolved. And I'm so happy for the people of Windsor. This was weighing on my shoulders, but everyone cooperated. I want to give a shout out to Dr. Ahmed too, and Mayor Dilkins. They're working their back off, and we ended up knocking down the barrier.
Okay, my real question now. I understand that an inappropriate comment was directed at you this morning from one of our NDP MPPs in Windsor-Essex, and there has been some backlash on Twitter that the comment is not doing Essex County any favors, and I'm just wondering what your response to receiving that comment was this morning in the legislature.
Well, something's water off a duck's back. I'll tell you, I've never heard anyone swear, and over 200 times I've been in the house. You just don't do that. But, it happens. I forgive the guy. Let's just move on. My main focus is I want to protect the people of Essex. I love the people there. They're, salt of the earth people, and so is Windsor. That's why we're doing everything we can to make sure we open up, which is great news, and I want to thank the team for doing that, led by the Minister of Health and Dr. Williams, Dr. Hart, and Matt Anderson. Everyone pitched in, and it's amazing. Like I always say, every time we hit a hurdle, we seem to get the troops together all around, not the government per se, but everyone involved, the stakeholders, and we end up getting through it. So I'm just so happy, and the folks in Kingsville and Leamington, we're throwing out every resource to get you back on track very, very quickly.
Follow-up?
Yes, and so I wonder then, for those people in Leamington and Kingsville, it might be difficult for them to not try to book a hair appointment or some type of appointment in Amherstburg or LaSalle or in the city of Windsor. So what's your message to them, and how will you, stop them, or will you try to stop them from going into other parts of Windsor-Essex for these appointments?
Well, there's no way of stopping anyone, and I've always said I don't like the so-called police state that if you go there, go there. We're just trying to protect the workers and the farmers. That's where it's really focused on, and not so much the general population. And we're going to get them to the next level as quickly as possible, because they're great folks out there, and I can't wait to go down there, by the way, and get this bushy haircut taken care of.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Allison.
Hi, Premier. I'm hoping you can touch on the expanded testing bit of your 3-point plan a little bit more. Is there something new in the testing regime that you're announcing today, or more the sort of focus mobile testing that you had been talking about before, and how is that going? Are you getting any more cooperation than you have been in the past?
Yeah, and I got to send it to the expert, Dr. Hire, as we always call him, Dr. Dirk, but this guy's a champion, I can tell you that. So I'm going to pass it over to Dr. Hire.
Thank you, Premier, and good afternoon, everybody. So thanks for that question. The farmers and the farm workers have been engaged in these discussions throughout. We started doing some testing and offering testing following recognition that there were some farms that were struggling with infections. And throughout, we've been engaged in conversations with the farmers. They've provided feedback to us about the approaches that we've taken, and we've listened, we've learned, and we've responded. Dr. Williams worked with the local medical officers of health across the province in thinking about strategies, as he talked about, groundbreaking in Ontario. And those were questions that those were things that flowed from the questions that the farmers and the employees asked. So what we've done is we've built an additional capacity for on-site testing. We continue to have the availability for an assessment approach that's based and people can come to. And we're really working with the farmers and the farm employees to provide the best service possible to do this as quickly as we can. So I think the additional things are additional perspectives from Dr. Williams, additional capacity for on-site testing, and continued engagement with OMAFRA, so the ministry overseeing and working with the farmers, as well as great engagement from the associations that work with the farmers, as well as the farmers.
Follow-up?
Okay, I see here that the news release says that about 350 asymptomatic workers have been tested since on-site testing launched this past weekend. So is it now 350 plus the 700 some odd who were tested before? Because that's really still just, about 1,000 workers out of the 8,000 in the area.
1,000 workers seems to me to be a large number, and really hats off to the farmers and hats off to those employees that attended, and also to the hospital staff who mobilized out to on-site work where it's hot. All of the workers are taking time from their work, and the employers have pulled them together to be able to allow this testing to occur. For me, 1,000 is a lot, and we're working to continue to do all of the workers that are in the area. We mobilized just starting Saturday for more additional on-site work, and so we're scheduling, and we were working on that yesterday. Multiple phone calls I was on working with OMAFRA as well as others and farmers. Great questions, great conversations, and we're moving along very quickly to support the farms.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi. Question first for the Premier. We've noticed that there's been long-term care facilities that have had outbreaks. They get named, but you're not naming or you're not mandating that the local health units name the farms that have had COVID-19 outbreaks. And you've also talked about how some farms are not cooperating with testing the workers. Some farms are, but some aren't. So wondering, why are you not naming the farms that are failing to cooperate? And why is the province not requiring that the farms that have outbreaks be publicized?
Well, first of all, Mike, we're comparing apples and oranges. The farms versus long-term care, it's night and day, and I want to give a thanks to OMAFRA. They've been on every single call. They've been working hard. The Minister of Agriculture has been working hard, along with the Minister of Labour and Minister of Health, and we're just working together. You got to walk a mile in their shoes, and none of us have. Just imagine you have a business, a farming business, which is tough at best of times. You're working your back off. You could lose your business in a few weeks. Your lifelong passion, and you could lose $25-50 million, just bang, gone. So we got to protect the farmers. They put food on our table, and then we have to protect the workers there too. They've come from a different country to jump in there, and they do it every single year. There's well over 11,000. Sometimes it'll peak up to 16,000 in the fall as well. These people mean no harm to Ontario. They're trying to help us. And the farmers are just phenomenal people. Man, like these people work their backs off, and I'm there to protect them, not to hurt them. So I don't like naming farms. Everyone's on side now. Everyone's working together, and again, it's amazing, Mike, when everyone's pulling on the same rope. Everyone comes up with a solution, and that's how we're able to open up Windsor. That's how we're going to open up Kingsville, Leamington very shortly once these numbers come down.
Follow-up?
On another topic.
And welcome back. That was Doug Ford's press conference today. Today he was joined by the Deputy Premier, Christine Elliott, like he is every day, but also Monty McNaughton, who is the Minister of Labour, Training and Skills Development, and also Dr. David Williams, who is the Chief Medical Officer, and Dr. Dirk Heyer, who is the Chief Coroner for the province of Ontario. One of the big things that came out of this, obviously, was they're going to be doing on-site testing at the largest farms down in Windsor, Essex County, trying to get control of COVID-19 there, because that is sort of one of the places where we have a real issue with regards to community spread. So we got speaking of community, we have a ton of people on social media this afternoon. We had a ton of people on this morning saying hi. So I'd like to say hi to Juliana, my girlfriend. Hey, hi to Bev, Fabiana, Nicole. Also to Daniel, my co-host in the morning, who is the owner of KC Securities, who sponsors Special Report. Thank you very much, Daniel. And Daniel will be back again tomorrow morning at 8 a.m. on Special Report, co-hosting with me tomorrow for the last day. And then I'll have a different co-host on Friday. And then I also like to say hello to Ineki. Good afternoon to you as well. And also hi to my mom, who's also watching. So hi, Mom. Thanks for joining us this afternoon. Okay, so I talked earlier today on Special Report AM about a poll that came out where Canadians want the 2-meter social distancing to continue. And now we're going to see a video here from Dr. Tam about 2 meters social distancing and that it will continue for the foreseeable future. Roll the tape.
And be reignited anywhere at any time. That doesn't mean we don't control our own future here in Canada. On the contrary, with COVID-19 around us, we can't have a reopening that doesn't include all of us working together to keep our guard up and keep the curve down. This is the long game. The first rule is to be aware of the risks of exposure and to make informed decisions, taking necessary precautions to keep you and your loved ones safe. Those precautions include keeping the 2 meters of physical distancing, washing hands often, covering coughs and sneezes, layering with a non-medical mask or face covering, and staying home when sick. And now that spaces are reopening, we need to avoid or strictly limit our time in settings and situations that increase our risk of exposure to the virus, like closed spaces with poor ventilation, crowded places with large numbers of people gathered, and close contacts where you can't keep the 2 meters apart from others. Thank you.
Teresa Tam talking about the 2 meter social distancing, or 6 feet, will continue for the foreseeable future. And the poll that just came out the other day from Leger showed that 2/3 of Canadians want the 2 meter distancing to stay in force at least for the foreseeable future, that most of them would be uncomfortable if it was reduced to 1.5 meters or even 1 meter. The World Health Organization is suggesting to all countries to have at least a 1 meter social distancing protocol in place. Now, Donald Trump is in election year, so he's beating the usual drums that he does when he wants to stir up his base. And of course, one of those things is trade. We have now seen that the U.S. is threatening once again to put tariffs on our aluminum. Now, for those of you who don't remember, when Donald Trump was first elected and came in, he put in tariffs on both our steel and aluminum. Obviously, that affects us here locally because of some local companies that deal with steel and aluminum. This is once again, Donald Trump went to the wall the other day. He tried to have a rally the other day. He has been saying certain things to rile up his base because he needs them to come out and support him in November if he's going to get a second term. I talked about this morning, he's at the same support levels that Jimmy Carter had before he wasn't reelected, and also George Bush Sr. when he wasn't reelected for a second term. So Donald Trump is doing whatever he can right now to try and drum up support. He wants to put a 10% tariff on our aluminum. Last time when that happened, Canada responded back by putting tariffs on a plethora of American products. And finally, both Canada and the U.S. backed down from all the tariffs. And once again, we got the free trade agreement done in that time period as well. But once again, Donald Trump is saying that somehow our aluminum is a threat to U.S. national security. Not quite sure how he actually justifies that, because he's never actually said why. That actually is a justification for it, but it is a very small, little-known rule that was actually put in after the War of 1812, which was a little different than 2020. So anyways, that was over 200 years ago. Okay, speaking of the border, someone tried to smuggle 418 pounds of marijuana over the border at the same time yesterday on the Ambassador Bridge. Obviously, that was caught. The Border Patrol found several odd shapes in the rear of the hauler that turned out to be 15 large bags of marijuana. Obviously, the driver was arrested and charged with possession and transportation of illegal drugs. Which I'm not sure why you're smuggling marijuana into Canada when you can walk down the street and buy it in a corner store. So anyways, oh, that was into the U.S. Sorry, the producer just told me it's going into the U.S. from Canada. Thank you very much. Alrighty. Oh yeah. Okay. We this morning talked about the Rainbow Camp. They've created something called the Rainbow Online Connection. This is going to be a virtual camp this summer because they cannot do overnight camps because those are prohibited for the time being. They need help and support. Right now they have a donor that's willing to match donations. So if you're able to donate to the camp, if you can go to helprainbowcamp.ca and make a donation there, it will be matched dollar for dollar. That would mean that they would have an additional $40,000 in revenue because they have someone who will be donating, matching up to $20,000. I'll see you tonight at 7 p.m. and also check out the news at 5. See you tomorrow morning at 8 a.m. on Special Report. Have a good night.